And welcome to the Voices of Longevity, a short form interview series from the Institute for Successful Longevity here at FSU. I'm your host, Victoria Valko, ISL's Outreach Assistant, and in each episode, we'll be speaking with ISL faculty affiliates to learn more about their work, with their perspectives, and the people behind their research, all under 15 minutes. So today I'm joined by Dr. Zhe He, and this is actually our ISL Director, so let's get started.
Yeah, thank you so much, Victoria, for helping out.
Absolutely. So could you please briefly introduce yourself and your role at the ISL?
Sure. Hello, everyone. My name is Zhe He. I'm currently a professor in the School of Information at FSU. I'm also currently serving as a director for the Institute for Successful Longevity. I'm a biomedical informatician and health data scientist. Had a formal training in both computer science and biomedical informatics. And as a director of ISL, my role is to really foster interdisciplinary research, connect researchers from our big community, and also promote innovation that improve the lives of older adults. Also on a personal note, I'm originally from China, so I'm an immigrant. I've been here with FSU since 2015, and this year actually closes my 10th year at FSU. So I'm really excited to kind of step up at this role to continue my contribution to our institution.
Congratulations, Dr. He. What first drew you to the field of aging and longevity research, and were there any personal connections or moments that inspired you along the way?
Definitely. As I mentioned before, I'm personally trained as a computer scientist and a medical informatician. So when I took this kind of technical route of my career, I was always have been thinking about how to better help people and how to better apply my technical and computational background into problems that are absolutely important. So it was a really combination of my technical background in health informatics and also growing realization that aging is something we all will experience in our life, but oftentimes overlook in research and design. So a key turning point for me for doing this research in this longevity direction is really being considered being appointed as a faculty affiliates at the Successful Longevity here at FSU when I was hired in 2015. I was among the first few colleagues here at FSU appointed as a faculty affiliate, working very closely with Dr. Neil Charnes, the founding director of ISL, and working together with many other wonderful colleagues here at FSU that really helping out, be able to figure out how to better design solutions to improve the life of older adults. So I have a few projects with older adults and dealing with, for example, designing and developing methods to improve the representation of old adults. And that research actually started when I was a postdoc at Columbia University, where I found that old adults are generally underrepresented in type 2 diabetes clinical trials. So I was intrigued by this type of phenomenon and trying to figure out the reason why such thing will happen. And when I got to FSU, I carry on this research and work with multidisciplinary research teams to use both data science methods and also data science informed interventional research to develop technologies and methods to help older adults with different health challenges. So on a personal note, I have two parents that are aging and they also need help. So I feel like a lot of my research can also help me better understand the support to older adults community and also my family as well. I think this is could be also another personal reason for me to have motivation to contribute to this field.
Or any other projects you have going on? Is there a recent discovery or part of that project that really excites you, and what makes it meaningful?
So what really makes meaningful for my research project is I definitely found super intriguing and interesting to work with multidisciplinary teams. So for example, in my the we call APT project, the adherence promotion using personalized technology project, I work with a psychologist, work with sociologists, work with computer scientists, and also information scientists, and also geriatrician to design and develop just-in-time intervention to help older adults adhere to the academic training programs that we develop. That project was super interesting because we're really working directly with older adults who are using this intervention And we're trying to figure out the reason why they like or they don't like this technology, and how can we use motivational messages tailored based on their motivation to help them better engage with the intervention. And in another project, which is called Lab Genie project, this is also one of my passion projects. And I also felt very excited to work with older adults directly because we use a participatory design approach that we really engage the user of the technology from the beginning to understand their information needs and also their challenges for understanding of medical data, especially lab test results, and also how to better provide better visualization and also tailor support to help them understand this data. And we found this is such an important problem and very interesting because we can bring in the best of both data science and the technology, and also the best of human-centered research and human subject research into this big research projects. I felt just it's super interesting and super excited.
And what's one thing you wished more people understood or knew more about concerning aging or the science behind it?
I wish more people would understand that aging is not a decline. It's a stage of life with diverse experiences and needs. So the science of aging is incredibly nuanced, and not all the older adults would face similar challenges. And much of the decline we associate with aging can be slowed or prevented with right interventions, environments, and support systems. So here we're just trying to leverage the best of technology, the best of data, and best of human research to understand the way to prevent and also to delay the decline, both cognitively and physically. So this is, I think, some of the information I think people should know.
Concerning aging or your Lab Genie project, how do you see your work making a difference for older adults or just in the community in general?
So I do see that our project is really trying to bridge the communication gap between healthcare systems and older adults, because many people, even if they have access to their medical data, but just because they have limited literacy or health literacy, they may not be able to fully understand this information, so that they have a hard time really act upon those information to make better health decisions with their doctors. So we're really trying to develop information technology that delivers understandable and comprehensible information to patients, and especially older adults and their caregivers, so they will feel more empowered and more engaged in their care. So our project is also provides tools to researchers and clinicians can use to reach populations that oftentimes are left out in the digital health conversation. So I think this really will make a difference, because with the best of AI and the best of technology, the communication can be greatly facilitated.
I know you mentioned that aging is a misconception, like it's not a decline, but are there any other common myths or misconceptions about aging that you're working to challenge through your research?
Absolutely. So one challenge and one misconception or myth for this type of population, old adults, is that oftentimes people found that they cannot or won't use technology. And this is simply not true. The issue is often how technology is designed, and many tools aren't built with old adults in mind. So my research really challenges that by employing what they call user-centered design principles, and it will show that when giving accessible, meaningful use, and old adults are just as capable of engaging with health technology as other groups.
And how has being a part of the ISL or your appointment to directorship helped shape your or support your work? And are there any unique opportunities or collaborations that stand out to you?
So ISL has been instrumental in connecting me with other colleagues around campus and across different disciplines with a shared mission and shared goal in a career, from nursing, from medicine to social science, social work to engineering. And these collaborations also really helped me broaden my research scope and impact, and understand how to really work with others using different terminologies and different language to co-develop technologies and solutions that address more holistic and community-based problems. And the ISL, we also have this wonderful research volunteer registry with over 3,700 participants, and this has been such a wonderful resource to accelerate recruitment of older adults into many different kinds of aging research around campus. And I just feel very excited and empowered to keep updating and building this registry to really help people with bidirectional study engagement We wanted to be able to help researchers get access to this population easily. We also want to help the people in the community to get access to research because many of these people want to get to learn and use the best of technology, the best intervention. So, I mean, this is definitely mutually beneficial.
What advice do you give to students, whether undergraduate through postdoc, that are interested in research or careers related to maybe aging, health informatics, and public health?
I think one advice I want to give is that you know definitely it's important to start by listening and talk to the users, talk to older adults, talk to the caregivers, talk to different community organizations to understand what really matters most to them. Because I really encourage people to think about the problems at hand and before designing and developing a solution. And as I mentioned before, aging research is deeply interdisciplinary. So we should be very open to learning from others' fields and also don't underestimate the impact of what it can make. And this is a field where real world consequences, growing relevance can be really make. Everyone can make a difference if you actually find the good people to collaborate and also a problem to work on.
As we're wrapping up our podcast, just for fun, what's something non-research related you're passionate about or that helps you unwind outside of work?
I do have a 4-year-old little son, so I really love playing with this kid because that really helped me, kind of, being out of my work. I do like watch movies and TV shows, and also listening to podcasts and different interviews. I feel excited about listening to other people sharing their successful stories, and also learning about their career development. And so this blend of tradition, because I'm a Chinese, I'm a Chinese immigrant, so I originally had inherited a lot of Chinese tradition and learning the literature and the mythology, and all of this really helped me shape who I am. I feel like a blend of tradition and innovation is something I feel very inspiring, both in life, in my research.
Well, that actually wraps up this episode and our pilot episode of the Voices of Longevity. A big thank you to Dr. Zhe He for sharing your work with us. And if you'd like to learn more about the ISL and the research that's happening within our network, you can visit our social media handles. And again, I'm Victoria Valko. Thank you for listening, and we'll see you next time on Voices of Longevity, where you meet the ISL researchers.
Thank you so much, Victoria.